We have an ageing population with increasing number of long-term conditions.
We're moving care out into the community, and that puts a strain onto general practice.
The expectation for providing a higher standard of safe care for patients is much higher than ever before.
We have difficulty replacing retiring nurses.
There aren't enough to fill the posts that are available at the moment.
We're an ageing workforce. If we don't get something sorted in the next 4 or 5 years, then there's going to be a mass exodus of practice nurses and there's going to be nobody to replace us.
We need to look at new way of working, and the collaboration is the way forward for that.
There hasn't been a pathway with the universities and with primary care to enable a student nurse to go into primary care for that as their placement.
Nurses need to find out what primary care is like, otherwise they're not going to be interested.
If we can manage to get student nurses into practice now, then they can actually learn from people who have such a vast wealth of experience.
I had to do a placement in a practice, GP's practice, which I thought that was going to be really boring, but turned out that it actually offered me opportunity to expand my knowledge in specialised areas. You get extra opportunity to improve your skills. You can always better yourself. There's always something new to do. I worked very closely with her, and she offered me opportunities to work in all her clinics in the evenings.
It's a real joy to be able to mentor students. They come to you all very shy and coy, and as the weeks progress you can see them growing, developing. We want them to understand primary care, and we want them to replace us who are going to be leaving in the not too distant future.
Once I qualified, all I wanted to do was work in the hospital in secondary situations, but now I would be much more for working within a practice, being able to specialise in areas, and it offers more opportunity and being more independent.
The collaboration between the GPs is enabling practices to take on student nurses, to allow a student nurse to experience general practice without having to change the way they work too much.
Their role is to work with the GP tutors for whole of the workforce, but specifically for nurse student placement. They have got role to liaise with the universities as well as practices and nurse students to ensure they have a good experience.
The CEPN has galvanised practices who perhaps up to now may not have thought about being involved in training, but now it's stimulated their interest in providing training opportunities and getting involved with producing the next generation of healthcare workforce.
We need to think differently. We need to collaborate and work together. We've got a crisis with the practice nurses and also GPs. Therefore, we've taken that as a step one to develop and attract those group of professionals to come into practice. In future, we are going to look at the whole of the workforce, including healthcare assistants, receptionists, practice managers, and physician associates. If I can manage to get educational training to be different to what it has been done in the past, of course we can do it. There is no plan B.